Great. Thank you for everyone for joining us. This is our first webinar for the new Rural Health Innovation Program here at UC Berkeley, part of our online MPH program. And we are very excited to offer this opportunity for you all to join us to learn more about the program. We'll be able to answer questions at the end. Here is our agenda for the session today. It's going to be mostly a high overview of some of these things. We do want to allow time for questions at the end. As Stephanie mentioned, this session is being recorded and we'll be able to send that out to you all. And if you had any colleagues that weren't able to attend, we'll be able to post the recording as well. Please save your questions to the end. It is hard to manage the chat while doing a webinar and screen sharing, but we do plan to save time for the end. If you do post questions in the chat, please note they will be addressed at the end of the session. We'll have some time for that. And Stephanie, if you can move on to next slide. So we just want to really do another great welcome. There's been such immense interest in this, overwhelmingly great. It's always hard when we start a brand new program. This is newly funded. We just officially announced it a few weeks ago, and it's great we have so many of you with us today. So we really want to thank you for taking time out of your busy schedules. We know it's very busy and a lot of time to attend these type of sessions. I am Christine Doss. My pronouns are she, her, hers. I am the program manager for the Health Policy Management Division at UC Berkeley in the School of Public Health, including the new Rural Health Innovation Program. And so what that includes is I will work directly with our scholars and fellows in the program for academic advising. The funding aspect of it will enhance student experience is part of this program, and visit logistics. We'll get into some of what the visits are and specific programming and overall student services for our students in the program. I have been working in higher education, specifically in public health, for over 15 years. And I have been with HPM, which is the acronym for Health Policy Management. You might hear that a few times in our session today for a little over 4 years. And so I am on the student services side of this program, and I wanted to give Stephanie a little chance to introduce herself as well, because you will also be working with Stephanie.
Thank you so much, Christine. And my name is Stephanie Nguyen. I am the online admissions recruitment manager. So essentially what that means is that I'm working with prospective applicants to share and provide more information about our program, but I also support you with the application process and making sure that everything looks good, you're confident about your application, and it's ready to go. In that sense, I come from a public health background myself. I have been specifically here with our program for a little over 5 years or so, and this division is also within the student services. So we're so excited to be able to present to you this opportunity and provide more information that might be helpful for you or your network. So without further ado, let's get right into it.
Thanks, Stephanie. So you might be asking, well, what's the value of the MPH and how is that going to help me and what I do with my population? And so here's a very high overview of this. You will get much more information within our program about all the different levels of the ecological model and how public health addresses individual behavior, lifestyle, all the way up to policy and institutional change. And so many of you are working with vulnerable populations that have many different concerns, pressing issues. What are the community issues? What are the health implications? And so our program is geared towards giving you the skills to go out and be a change maker and a leader within your community and the population that you serve to improve overall health. And so we know you're all experienced public health professionals, whether or not that's in your title at work or how other people see what you do, because public health is very broad and there's a lot of things that we do in public health, but you're all experienced workers. And so you're seeking to master these public health skills to bring that back to your community. And so the value of our MPH and the Masters of Public Health in general is really geared towards change makers seeking to have an impact through professional activities that advance public health, especially in your communities. It's transformational. It's big system changes. And these problems require really bold solutions and support building more resilience with new approaches, creative ways of thinking, system thinking, and incorporate different crisis or different emerging issues that are coming up that weren't there yesterday. And so now what do we do when we have some crisis management tools that we do include in the MPH? It is an interdisciplinary approach, so it's not clinical or not solely medical based, the MPH. It is social science as well, but it is evidence-based, but we do not have clinical lab work. The labs we have are more labs using data science software like R, Stata, SPSS. So those are the labs that we have. So it's not clinical, but you're gaining skills that you can take back into your clinical setting if that's where you work. So again, it's evidence-based. It draws on many formats, techniques, and areas of expertise from our faculty. And it's translational, meaning that it helps foster connections between different stakeholders within your community, because that's how we enact change. And so we give you the skills and tools to go do that. So this is a very broad, high overview of the public health and the Master of Public Health program that we offer. One of the questions that we'll probably get from you, at least one of you will ask, so we have the Rural Health Innovation Program includes a scholarship, and this is funding 25 students each year for 4 years, so a total of 100 students will be scholars, and this includes, our program is fully funded. That includes fees, tuition. If there's any books, usually our online program does not require purchasing of books, but if there's any software that you need upgraded or any of the statistical packages that are out there, we'll include that, plus funding for our summer site visits, which we will get into in a little bit about what those actually are. And it includes specific rural health programming during the 2 different on-campus visits, and some faculty mentoring around specific issues that you're facing in your communities or that you would like to address. Within that, we will have fellows also, and these are going to be 10 of the scholars can become fellows. They will be selected during the second semester in the first summer visit. And this includes a fully funded trip to Washington, D.C. in February. And this is for the Rural Health Policy Institute that's held every February in the beginning to mid-February of each spring. So the first visit will be in spring 2025 if you're a cohort coming in at spring 2024. So this includes a fully funded trip to DC for a week, also a specific mentored policy practicum, and we'll get into what that practicum is, but usually, or we're expecting the Policy Institute trip to lead into a policy project for your practicum. So that's the idea behind that. But you'll get to meet policy leaders, some of the legislators. You'll also attend it with a few of us, so it'll be well curated event.
So with that said, you might be interested about the program overview and what it looks like. So essentially, we are a 42-unit program. In order to graduate. The time to complete the program is within 27 months. So it's a 7-semester part-time program. This program, the type of degree that we offer is a professional MPH. So regardless of your concentration, you are earning a professional degree. The format that we offer is 90% online and 10% in person. The 10% in person is mostly focused on the summer campus visit. And any external requirements for travel. The course delivery in our program is that it's asynchronous. So that's one of the many benefits, I would say, that really set us apart in the online space, because you're busy. You are busy professionals, your network is busy. And the nice thing about an asynchronous format is that you can work, at a time that is convenient to you, but you just want to make sure that you meet the deadlines that are given within the assignment. So it makes it really flexible for working professionals. So you're not required to be online at a specific time. The weekly commitment that I would say our students typically survey is averaging around 15 to 17 hours per week on course assignments. So this is just a high level overview of what to expect as a student in our program. Choosing your concentration, this is an exciting piece here. So we offer specific concentrations within health policy and management, epidemiology and biostatistics, public health nutrition. We also have a new graduate certificate within health management that students can tack on to their curriculum. But we also have an interdisciplinary concentration as well. So within the interdisciplinary area, there is something called tracks. So tracks are usually a cluster of courses that you can combine with other cluster courses or tracks, if you will, and make it as your own. So that is community health sciences, global health, spatial data sciences for public health. So if you're interested in looking into our curriculum a little bit more in depth, highly encourage you to check out our website, which is linked here, and I will send this out to you as well. It gives you a great detail of what the specific concentrations offer and just more information around that. But for scholars, you can pick within any of these other areas, but for fellows, if you're interested in specifically health policy, which we'll get into a little bit more into the slides, but make sure to let us know so we can make sure to see the differentiation of that. And is there anything else you'd like to add to this, Christine?
Thanks, Stephanie. I would also like to add, also just encouraging you to review our website for these specific concentrations, but also know that you're still getting 1 degree. It's a master's of public health. And so if you come in as an epidemiology and biostatistics interest, but you're really interested in that health economics course, and you want to change into the health policy management curriculum, you can. That's something that we can help you with and we can talk you through. So it's not, when you come into the online MPH, you're not tied to one of these concentrations from your first day. That's something that we help, and our faculty advisors also help walk through students and what are your interests, what are your needs, what electives and classes, what skills do you want to put in your toolbox, and maybe it fits within one of these concentrations, maybe not. So we do have some flexibility with that. But when you do apply, you would select one of these in the application process, but that can change once you're in our program.
And I've also linked in our website, so if you want to just take a look at that, there's going to be a wealth of information about each concentration. So feel free to explore that.
So not only do you have coursework, the 42 units of coursework, but there's also a practicum requirement, and this is for all of our students. It's not just for our rural health scholars or fellows. So all of our online MPH students do a practicum. The minimum is 130 hours, and there's various ways to complete it. We do have a specific career services and practicum team that will work with our students on opportunities, designing, what does that look like? We're seeing about 70% of our current students do complete their practicum at their current place of employment. They're just maybe working with a different supervisor, working on a separate project, doing something that is not part of their normal job duties, because we want to make sure you're getting the skills, new skills that you want to build on and expand on, and then possibly do a career shift or expand your growth or your role. And so we really don't want to see our students kind of doing what you're already experts on. So this is a way to enhance some of your skills. And it is structured with they're called the RISE team, which is our career and practicum specialist. And the fellows, the other thing that differentiates the fellows from the scholars is that they're required to complete a policy specific practicum. And there will be mentorship around that from some of our faculty as well as the program. And that leads back to the trip to Washington, D.C. to the Rural Health Policy Institute, is that you can make some connections there to create a project, jump on a project that's in progress, start a project, evaluate a project. There's a lot of different ways to complete the practicum. And the majority of our students do start this in their third or fourth semester. You could start it as early as your second semester. It just, the hours and the deliverables need to be done before your final semester. So within that 27-month time frame, there's a lot of time to work on your practicum. You do not need to come into the program already knowing what to do for your practicum and where to work. This is similar, if you've seen other MPH programs, they might call it field work experience or internship. It's roughly similar, just using different names, different terms, and we call it a practicum here, and all of our students complete this. It's a great opportunity to step out and do something different, learn something new, actually use the skills you've learned in the classroom, in the virtual classroom, and use that out in the actual field to do actual work with real clients, real organization, making real change. This is a great opportunity. And then we wanted to provide you with, well, what does that 27 months look like? And so here's an academic timeline of, we're expecting our first cohort to come in spring 2024. So that's next spring. That would be in early to mid-January is when we're on a semester system at UC Berkeley. And so your first year, which would include your first spring, the summer, and the fall, are going to be the core MPH courses. So all of our students, regardless of what concentration you are, or if you're one of our scholars or fellows, you're all taking these same classes. And this would be, these are our breadth courses. So you would take a course in environmental health science, health and social behavior, epidemiology, a separate one in biostatistics. We do have a health policy management breadth course. And so those would be taken during your first year. We do require an on-campus summer visit. So as Stephanie had mentioned earlier, it's 90% online and 10% in person. So you'll be here with us for 2 summers. And so there will be a week that you come each summer. The first summer would be 2024, and that would be part of our health policy management breadth course. And as a scholar, you would also get an enhanced experience with that. So you would come for at least 1 or 2 extra days for that funded, but it would be focused on that group and issues that related to what you're experiencing in your community. And we'll have some experts come and talk and do some more deep dive into policy changes within that. And then that will also happen during the second year summer visit, which will happen in summer 2025. And that is part of our interdisciplinary seminar, which includes our leadership and ethics component. So not only are you going to learn skills in change making, but also, well, what does a leader look like? How do you become a leader? You're already leaders. How do you enhance that? So we do have a whole course on that and an immersive experience during the summer, specifically on that. So that will be the second summer. Again, that's fully funded, regardless if you're a scholar or a fellow for these summer visits. You will come to UC Berkeley campus. You can see the beautiful, one of our libraries behind us. You'll have access to that and to our campus, and we will set up housing and logistics and everything will be taken care of by us. So you can see here that some of our courses are taken together. You'll be taking 2 classes each semester. So each semester it is about 6 units. Some of our classes are different units, but the typical 6 units. And the first year, the classes, you'll take them together. So we call them our full term. They're 15-week classes. You're taking them at the same time. Starting in year 2, as you see here in spring 2025, so that would be your 7th class, you start taking them there accelerated. but they're not taken they're not taken consecutively. Sorry, they're not taken concurrently, they are taken consecutively. So you'll take one class in the first half of the semester that will end, and then you will start the second class. So the time that you're spending in the classes still will remain 15 to 17 hours per week, because the accelerated classes, you'll spend about that per class, but the ones that are stretched out to the full term, because you're doing two, but they're longer. So you'll have less commitment per week in each class because it's stretched out. And then spring 2026, you're done. That's when our first cohort will graduate. And so you'll see it's a full cycle here with the classes, and that will include you're completed with the practicum as well. And then we also wanted to provide a sample schedule. What could those classes look like? So here is a sample spring start schedule that you can look here. We have more details of different sample schedules with the different concentrations on our website. But here is what you might expect if you were to come in spring 2024. Your first semester would be our health and social behavior class plus epidemiology. Summer session would be the health policy management breadth course and an elective. Here's an option for one that is an HPM specific course, a strategy in healthcare organizations, which is always very popular. And then fall would be your second set of breadth courses, which is environmental health sciences, and then probability and statistics. And then second year is where you can start selecting either your electives or your core concentration courses. And all of this can vary based on what concentration you're in. And that's one thing you'll work with me and our faculty directors on, is mostly for going into year two, what classes to take, what skills you want to build, what classes are you interested in, what tools or prerequisites are needed for those. So it's very student services support from us to help define your classes. And the second spring semester, second year, which would be 2025, is when the fellows will also do the visit to Washington, D.C.
So with our application checklist, there's a few prerequisites that we want to make sure that you have before submitting your application. So the prerequisites, we want to make sure that you must reside and work in rural US locations. There will be a supplemental application for the RHI scholarship as well. So these details may include an essay, and what I would say it'd have is, what rural population are you serving? What are the pressing problems within your community? What skills do you want or need to get an MPH for and bring back to said community? And if you're interested in health policy or the policy fellowship, please also clearly indicate that in your supplemental essay. That will just really help us make sure that you're considered for the program you want to apply for. In addition to that, we want to make sure that you have a minimum of 2 years of professional work experience. And this is usually within post-baccalaureate work experience. So that, I think, is also a critical piece. Statistics or college level math with a B+ or higher, familiarity and aptitude in biological or social sciences, and a minimum of a 3.0 GPA. The requirements to submit your application. So Berkeley is very unique in that we require an advanced GPA calculation. I am your go-to person to help you calculate this. And basically it is a calculation of your undergraduate coursework after your first 2 years of enrollment up until your conferment date. So it's a link here that you can check out, but if you run into any issues and you're unsure about how to calculate this, I'll leave my information in the chat. It's also in the end of the slides for you to reach out to. The statement of purpose is about 1,000 words, same for the personal history statement as well, but we do require 2 separate essays, so keep that in mind. The statement of purpose is more focused on the hows, the whys in regards to an MPH, UC Berkeley's online MPH program, the scholarships, that you're interested in. For example, if you're interested in health policy, and let us know. We want to know what concentration excites you and motivates you, and why this is the perfect place to get your MPH at. We want to know what gaps and skill sets that you need to fill, and we can be that team to build a partnership with, right? The personal history statement is a little I would consider this to be more of a reflection leading up to the moment of submitting your application. So this gives us a chance to humanize the process. We want to see a little bit more about your aha moments, what led you to an MPH. So, if there's any indicators of how you got to thinking about public health or the work that you do, or things that tie to graduate school, anything that's in relation to that can be very useful in the personal history statement. The 3 letters of recommendation, we do ask that it comes from an academic or professional network as well. So if you've been out of school for typically 5 years or more, it's okay to reach out to your professional network to still get an academic letter. So what I mean by this is, let's say you work on projects that do entail quantitative data or research work. These are still skill sets that would be really valuable in graduate school and specifically in our program. So these are things that you can allude to that can cover for an academic letter. Transcripts, it's okay if it's unofficial e-transcripts, meaning electronic transcripts for all college level coursework. But if you prefer to submit official copies, you can also email it directly to us and we can help you upload it on your behalf. But unofficial transcripts, as long as they have all the information that would appear on your official copy, that's what we would need. If you attended any international institutions, we would also need those transcripts. So you just want to make sure that it includes original transcripts, degree certificates, and in some cases, translated copies. So if you're unsure about this information here, definitely check in with us. Never make the assumption that what you had for another institution was good to go. This sometimes can hold up your application. So I really want to emphasize that. We also ask that you have submitted your most updated resume or CV and one documented proof of work experience. So this can be a letter from your employer, this can be a tax stub, this can be an onboarding letter. But in the event that you choose something that's not coming from your employer, just make sure to redact any sensitive information, such as a social security number. We would never ask for that type of information. We just want to make sure that it is validated in regards to what you share in your resume or CV. The only fee that you would be responsible in the application portion is the application fee itself. So it is $135 to submit an application. It is also optional for you to submit a GRE. This is an exam that can cover your verbal skills, quantitative skills, writing skills. If you do not want to submit it, we have other spaces in your application to highlight other skills such as your quant skills or research work. If you do choose to submit it, please send the score codes to 4833. And to apply, we only use the UC Berkeley graduate application. So you want to select Public Health Online, which will lead you directly to our application. Select Spring 2024. And keep in mind that we do not use SOFAs. We do not require it. It's only one graduate application. With that said, the typical timeline for the spring online admission cycle is pretty straightforward in the sense that the application is currently open. So if you're ready to rock and roll, please submit your application as soon as you're ready. It is not rolling admissions, but keep in mind that the application is open for quite some time. So our application deadline will close August 13th. The decisions are typically released between October, I would say late October, early November of 2023. And the cohort will start within January of 2024. If you have any questions related to your application, please reach out to me. You can always book an advising appointment with me. You can email me. If you have any specific questions about the scholarship or fellowship, and determining more details about your eligibility, you can contact our email specific to the scholarships and fellowships. And we'd love for you to keep in touch with us. So you can check out our social media platforms and stay connected. And with that said, I'd love to open up the Q&A. So if you have any questions, feel free to unmute yourself. You can use the hand function if it's easier, and drop in your questions in the chat. I'm going to call ahead first for the first name that I see, Ezekiel.
Yeah, hi. I was curious about what rural definition you're using. I'm in rural Massachusetts, and we have our own state definition because the federal definition is not super applicable to New England. So I was curious about that.
That's a great question. Thank you for asking. We're roughly looking at the HRSA definition of rural, but it is very open to what that interpretation is. So we would just need to, if you're interested in applying and you're not quite sure, ask us. We can set up a one-on-one, include in your essay what population you're serving, and how do you identify it as rural, or how is it identified as rural in the community that you're serving or the state that you're in, because rural can vary differently in California versus the Dakotas versus Maryland. It's all very subjective. So that is very open. But that's a great question. Thank you.
Thank you.
And see if I saw, I think Patricia, you may have had your hand up as well.
I did, but that was the same question I had.
Okay,
Thank
awesome.
you.
And there's a question, really good question in the chat. Thank you. So we are you looking to, my chat, okay. Are you looking to fund scholarships who don't already hold a master's degree? Yes. So as long as you do not hold a master's of public health from accredited university, you can apply to our program, as long as you have the equivalent of a 4-year degree earned from an accredited university, whether that's here in the US or abroad, but it needs to be equivalent to a 4-year university undergrad degree. So if you already hold a master's in education, come on and apply to our degree. This is a graduate division, and you see policy that we cannot duplicate degrees. So if you have a doctorate of public health or a master of public health, you cannot apply to our program. If you have a PhD in education, you can apply to our program. If you have an MD, if you have a PharmD, you can apply to our program.
I also received a direct message, so I will read this out. I think this is great for everyone to know. So when would applicants know if they have been admitted? It typically takes about 6 to 8 weeks for us to send out an electronic decision, and this decision will come from the Office of Graduate Admissions for a formal letter. And when we process, oh, go ahead.
Go ahead, Stephanie.
I was going to say, when we, thank you. When we process your applications from this deadline, we typically have about a 2-week period to check for completeness. So we actually don't process your applications right from when you submit your application. We typically take about a week or two to look at your application, make sure that you're not missing any documents, and give you a little bit of leeway to collect any missing materials to move your application forward. So from that moment when we check off and say good to go, that whole process takes about 6 to 8 weeks. So it goes through a committee of the admissions team, a faculty committee, the Office of Graduate Admissions. It's a whole long process to ensure that it's a holistic and equitable review, and then you get your decision letter. So hopefully there's some transparency around there as well. And then I got a secondary question, which was, are we required to stay at UC Berkeley in-house for the summer stay?
That's a good question. For the summer visit, we can provide on-campus housing, but that will be in apartments or on-campus housing with our dormitories, but not what you what you might have experienced as an undergrad dorm. These are more of apartments, shared living arrangements, but that's also open to the logistics planning, and so that more information will come. But I do not foresee, and I know this is being recorded, so I do not foresee you will be forced to stay on campus. So if you want to bring family, we actually have quite a few of our online students so everyone is required to do these on-campus visits as part of our program. So they do bring family, and they do stay either with relatives, or they will stay at an Airbnb or a hotel, but they do bring their family with them. We know many of our students have children, or they have other adults they're caring for, so they're more than welcome to bring them. We do tend to have activities in the second summer that all families are invited to, but you're more than welcome to make your own arrangements, and we can figure out what that looks like closer to that time.
Another question that I had received is, how strict is the rural resident prerequisite? I'm not sure I live in rural, but serve rural population.
So that's another good question. And I also got a chat about that, that if you work on rural health issues, but do not live or work in a rural area, does that qualify? Please reach out to us, because these are the questions we want to hear from you, because we don't have, it's not a strict eligibility, because this is specifically to the scholarship program. This is not to the online MPH program. We're gathering these questions. We're frantically making notes, and we're going to save all the chats so we can provide this information and what was asked of the participants of the webinar to our larger team, and that we can get these answers out to you. So it is open to what the rural eligibility is right now, as it's worded, and that we've been conveying to people, is that you must work and live in rural communities. But what's the definition of rural? That I think can be open, and we can provide more information once we get that clarified.
So is there a link for the supplemental RHI application, or is that a box that is checked and then populated while applying for the online MPH?
So right now, that's going to be a separate application, a link to a separate application. This is all fast moving. We got funding for this, which is great and awesome. And we want our students to start as soon as possible, so you can go out and do great things in your community. So we were not able to update the application for spring 2024 with all of that information, because it's actually live right now. So there will be a link either we provide to you, because we have all your information, and we're keeping track of emails and who's been attending and filling out our intake form and who's been emailing us, so we can send you what that supplemental application is. It will most likely be an additional essay, and to check that you are interested in the scholarship and that you meet some of the extra eligibility criteria for that. But right now it is not in the online MPH application. If you're interested in applying for a future cohort, so you can apply and for spring 2025, and then everything we talked about just push back a year, it will be built into that application. There was another question from Rachel. Thank you for putting that in the chat. Good question. Explain more about the scholarship. So this is a scholarship funded by the Barr Campbell Foundation, specifically alumni of our MPH program, Lynn Barr, who is a very big advocate for rural health. This is what she lives and breathes, and she's an alumna of our program. You might have heard her speak at the Policy Institute and probably saw some press releases with quotes from her, and she's doing a big push for this. So this is specifically funded by her foundation to fund 100 students to come through our online MPH program. The funding includes all the tuition and fees, So there would be no cost to get a Master's of Public Health from UC Berkeley. We are a top ranked research institute. Our online program has been, we're in our 11th year. So we're one of the longer standing online MPH programs. You get our tenured faculty that are part of UC Berkeley. Our faculty teach in both the online and the residential space. So you will be with professors and you'll also get an enhanced experience by being a scholar. The scholarship will also include funding to attend our summer visits, and that will include travel and housing. And if you're a fellow, that will include all of that, plus a policy specific practicum that is curated and structured with one of our faculty, or we'll help make those connections to be a policy specific practicum. And it includes a trip to Washington, D.C. in February to the Rural Health Policy Institute, which happens in February. So if you're planning to apply for spring 2024, that trip would be in spring 2025. So we do not expect outside costs for you to be in our program and to graduate from our program. We will cover if there's any other fees. Usually our online program does not require textbooks. We usually make everything available within our course sites. But if there are other technology needs, as in software, that could be also included in the scholarship.
I also received another question, which is, does the 2 years of work experience have to be completed post-baccalaureate? Would a mix of post-bac and fourth year work be considered as long as it meets the 2-year mark? And this is a great question, but we typically define the work experience as post-baccalaureate work experience. So anything after your conferment date.
I would also add to that, because that's a very common question that we get with many of applicants to the online program, is we also assume you are working in your job until you start our program. So we do consider that timeline as well. So if you're looking to apply now, and right now you do not have that 2 years post-bac experience, but by January 2024, you will, please apply. And that all of that is considered in the application. And then also by doing the online program, it enables you to continue working in your job, or if it allows you the flexibility if you do a career shift mid-program. That's definitely something that our students do experience, and this allows you to do that by doing all the coursework online, excluding the 2 summer visits.
Tell me if this is too specific a question. My undergrad institution used narrative evaluations rather than grades, and so I don't have a GPA. That is my question. How does that work?
So with that, if you can send your transcripts over to us, usually if it's coming from an accredited institution, we are able to work with you. And if we don't have an immediate answer for you, I'm always happy to connect with the larger Office of Graduate Admissions and see what the policy around this is. But in some cases, we have had students that have very unique transcripts, what I would call an exceptional case. And we've been able to work out, we've been able to be approved for these students to continue on with the process. So if you don't mind just reaching out to me directly, with my chat here, and then sending your transcripts over and we can take a look at it, or just letting me know the school.
Will do. Thank you.
It's actually always exciting to see what kind of transcripts we receive, because we see it all. So just make sure to send if anyone is sending any transcripts over to us, just make sure that you have your transcripts from all institutions attended, so that way we can make sure to take a look at everything all at once. Especially if we're calculating GPAs or anything like that, it can always disrupt the actual calculation if something's missing. So just a helpful tip there. And please continue. I know we have about 11 more minutes until this webinar ends, but these are amazing questions. Please continue to ask away. The questions that you're asking is seriously very helpful for all other attendees or those that couldn't have attended today, but may want to know. So please feel free to share your questions. Patricia?
Great, thank you. So since there is one application for the MPH, it could be a possibility that we get accepted into the program, but possibly not for the scholarship. Is that right?
That's correct.
Yeah. We have 25 scholars that we can offer the scholarship to. But we can admit many more into the online MPH program. So what, depending on how many people apply to the scholarship, also, you would have to be admitted first to the online MPH program. It goes through our admissions review process. And then there's going to be a separate committee that's going to review those for the scholarship. So there would be a possibility that we do have students admitted to the online MPH program, but not admitted to the scholarship. There can be a possibility that we will have alternates to the scholarship because we would love everyone to say yes to us, everyone that we offer the scholarship and admission to us, but we know you might get offers from other universities or life changes. And so this might not be a good time to start. So we call it a yield. So we do anticipate some students to say no, to decline their offer of both admissions and the scholarship. So then there will be opportunity if we do end up having an alternate for the scholarship for people to move up that. We can't see that. This is our first year doing this. And so we're already overwhelmed with interest in this program. But some of you on the call now, or some that have expressed interest, might not want to start yet. They might need another year to start. So this will be rolling out. The scholarship is starting for the next 4 springs. So we will have 4 cohorts. So there'll be different opportunities to apply to the program as well as a scholarship. You don't have to do it this spring.
I also have another question in the chat of what is the scholarship deadline? So it is also going to be the same date as your application deadline. We want to make sure that everything is all organized so we can conduct the holistic review as we're making our decision based on that. So make sure to get your information all together for your application. When you say overwhelmed, how much interest have you received roughly?
Well, there's 12 of you here today. But we've had what Stephanie, maybe 80 or 75 to 80 people fill out our interest form. If you attended or heard about the event at the Policy Institute, that was a couple of weeks ago, there was about 20 people that were interested and actually filled out the form. So when I say overwhelmed, it's like, we're just excited. It exceeded our expectations. We didn't know how much interest there would be for this program going into it. So we will be holding more of these webinars as information goes out. But we also know this is not all of you are going to apply. So we have had quite a bit of interest, but what that relates to in actual applications and submitted applications, we don't know yet.
Another question I saw was one more question on the recommendation letters. You mentioned if we've been out of school for some time, we can get professional letters. Can you add a little more clarification on that? Yes, so with the letters of recommendation, we know that most of you have graduated, so maybe you don't keep in contact with your former professors anymore, and that's okay. In that context, it's okay to use supervisors, previous supervisors, folks within your network that can speak to your academic potential and promise. So we want to make sure that the letters of recommendation capture and validate your experiences and really showcase that you are ready to go. You're going to be a strong, competitive applicant, but also be an engaging cohort. with graduate school, it is not solely on you. There's so much activities that are going to require you to be in teams, and we want to make sure that we're selecting students that can balance between the two. You can do independent work, but you can also engage very thoughtfully and intentionally in an online graduate program at that. So it's okay to use professional networks, meaning supervisors or previous employers that I tend to start off from top of the chain and work that way. So I would say step away from using friends or anyone else, family members. We really want to keep this professional. And in terms of the letters of recommendation, I actually have slides from a previous workshop that I conducted. So I'm always happy to share that and include that in our follow-up message that we'll send to you. So hopefully that answers your question. Let me know if you're looking for more details.
I'd also like to add on the references, because the majority of our students in the online program have been working professionals for a little while, and that it is hard to go back maybe 10, 15, 20 years ago when you were an undergrad, or in med school, or whenever you were last enrolled in classes. But also consider how many trainings have you attended or participated in or have facilitated yourself. So if you have any connections from that, that could also speak to your academic potential, but it's not coming from a professor. But you've probably all done something out in the field, either for continuing education or to get skills, to learn something new, something came out. Maybe you facilitated a training yourself, and you maybe worked with a team or worked with another organization. So consider that as well, as that could be a professional reference, but that could speak to your academic promise, and that you can do well in an MPH program, that you will succeed, and then also carry on out into the field as well.
And then for letters of recommendation, to be clear, we need 3 for the MPH, and will there be any separate recommendations for the scholarship application?
I think not. I think that it's just 3 for the online MPH program. And then the only thing that would be supplemental for the scholarship is the additional essay. That we will send you a separate form to fill out for that. If you can include recommendations or in anybody that can speak to you're all working somewhat with rural health and with issues facing that population. So ideally your references would speak to that as well. If you've done a recent career shift, that's fine also. It's not required specifically for the scholarship.
I also received another question around the scholarships. So if there's not enough students to award the 25 scholarships, would those scholarships roll over to subsequent years?
That's an excellent question that we do not have an answer at this time, but we will
Actually,
definitely
I
bring that
do.
back to the team.
I do have.
Awesome. So
we
our
have
director is
Kathy
actually
Garza,
here.
who was
Director.
the executive director of the online MPH program, who can answer.
Yes, our agreement with the donor is that we offer 100 scholarships within 4 years. So if we don't have 25 in 1 year, we can roll that over. So that's the answer.
Thanks, Kathy. So we have a full team here to support you. One thing I do want to mention, that Stephanie and I are very, very high touch, and that is very unique to the online MPH program. So you get high touch regarding the application and admission process, and then you get high touch with me and our faculty directors and our other student services team for advising. So you get support from when you submit your interest form, when you attend our webinar, all the way up to when you walk across our graduation stage. So there's a lot of support, and that comes with the online program. You will get enhanced support as being one of our scholars and fellows.
I think with that said, this concludes our webinar, and I really appreciate you all taking the time to join us. I know everyone's really busy, so this hour, I hope you found valuable. If there's any information that you feel you still need to know more about or anything like that, please do not hesitate to contact us. As she mentioned, Christine has said, we are high tech, we mean it. And some takeaways from this is that the scholarship was very intentional. Lynn was intentional about where she wanted to host the scholarships with our program, because public health, as we mentioned, is a very broad space, but we are doing the work to disrupt things that we have never done before. This is a space for you to, excel on new skill sets and sharpen some of the skill sets you already have in place. So we want to be able to have a home for you to do that. And we really look forward to receiving your application. So if you have any questions at all, please do not hesitate to contact us at any point. With that said, I hope you have a great evening and take care.
Yeah,
I'll send this
thank
out
you,
within 40
everyone.
hours. Bye.